Morning, everyone. It's wonderful to be here and talk about what's happening in AI from a healthcare perspective. And quite an impressive gathering. When I was walking in, I realized that it's like there's so many people who are enthusiastic about AI, and there's so much work which is happening in this particular space. I'll give a quick background about what Portea Medical does, so you have an idea about the context in which we are talking. So Portea is India's largest outside the hospital healthcare services company. So basically, what that means is that people go to hospitals for all the tertiary care, and they go to clinics to meet doctors. And of course, everything, all the healthcare needs which they have post that in the comforts of their home or at their workplaces is managed by us. Of course, there are 4 key segments in which we work. There will be primary care, post-operative care when people get discharged from the hospitals, elder care, and chronic disease management. And what we are seeing, some of the other statistics, we are the largest player, footprint across 40 states in the country, 40 cities in the country across all the states. We have served over 1 million patients so far, and continue to serve around 20,000 patients a month right now as we speak. Work with all the large partners across the country, across all the ecosystem players in healthcare, whether it's hospitals, insurance companies, pharmaceutical, and so on and so forth. And of course, on the right-hand side, if you see, that's a range of services which we provide. So physiotherapy, post-operative care, diagnostics, elder care, diabetes management, cancer care, those kind of things which we are providing services to the patients across the full spectrum of the care in the comforts of their home. Last count, we spent close to 1.5 million hours in patient homes every month, and work with them to basically provide them the best of the care, the world-class care, which is possible. We have good hospitals in this country now, corporate hospitals which are taking care of patients' tertiary care needs. Of course, the same world-class healthcare should be provided at homes, and that's something which we have aimed to do and have been doing it for over a period of time. Of course, technology has changed in the last 20 to 30 years, and we are discussing this just before me, the last speaker was talking about. If you look at last 30 years in India, right, we had the first big change when the satellite TV came in 90s. Okay, that was a big change. We had access to so much more information which was coming to our living rooms and our drawing rooms and so on and so forth. Then, of course, early 2000s, internet came. Of course, that information moved from your TV to your computers. And late 2000s, of course, 2010, in that decade, we got mobile phones. The information came into your pockets, correct? Now, what is happening in this with the advent of AI and all the digital and the data collection which is happening, the information which will start coming to you or which is coming to you now will be more and more customized about you, is more and more relevant for you, right? So you had basically the way information is disseminated to you and the way information you can use for yourself is continuously becoming more and more and more personalized. If you see healthcare of all the verticals of all the businesses, healthcare is something which has been a lot more generic over a period of time. And the big change which you see in healthcare from the industry perspective, the change is happening from getting it to making it more and more personalized about you in general, right? Because healthcare as a cancer patient is a cancer patient, and everybody looks at how we treat them. And then, of course, how do you look at each individual's case? How do you basically treat them? How do you surgery or other procedures? And then how do you take care of them in a very personalized manner, right? And that is something which is becoming very, very critical as we go along. And that's where, if you see from AI perspective, the AI can make the biggest change in making healthcare very personalized to you, correct? So far, we always look at healthcare in a very, very generic manner, but I think the time has come where with the usage of data, with the usage of point-of-care devices and AI, you can make healthcare very, very personalized. And I think if you look into the future, 10 years from now, 15 years from now, the biggest change will be that how do you interact with your patients, how do you collect their data, and how do you make sure they have access to their healthcare plans as an individual's healthcare plan and not a generic healthcare plan. And that is something which we have done over a period of time, of course, largely using technology. And I see a lot more acceleration in that happening with all the new tools which are coming into play. So, of course, we know that AI is revolutionizing the global healthcare. The market is growing significantly. A fifth of healthcare organizations are already using AI in some form or other, right? The predictive AI tools could reduce hospital admissions by half. And if you look at, when you look at healthcare, you look at the healthcare ecosystem, you look at each of the players and what is possible over there, right? And of course, the discovering new drugs, the cost could be reduced by over 70%. These are some of the large predictions, large potential areas which we have from the use of AI in healthcare perspective. And these are top use cases if you see. AI in healthcare is medical simulation, drug discovery, which is very important for pharmaceutical companies, medical chatbots, which is something which has already started picking up. When COVID happened, the first wave, it was something very, very new. Nobody knew what kind of symptoms to look out for, what to do. And it happened in early 2020. We worked with Goa government at that time and created a chatbot, which patients could use or consumers could use. They could reach out to their chatbot. All the information is stored over there, and they could basically interact with that and get all their queries answered on COVID, actually. And that was, of course, the advent of it. And then, of course, COVID became much more severe than that. But if you look at the uses of technology, and we saw that while we worked with many governments at that time, how we could use technology, how we could use basically data which you're collecting remotely from the patient and use that basically over a period of time to create personalized care plans for each of the individuals. I think that's something which is a massive changes. So chatbot is something which is being used quite actively now. And as I mentioned, we started using it during COVID time. Medical imaging is a big area. I think if you see from medical imaging perspective, a lot of activity in India, abroad is happening on how you can use AI in radiology, how you can use AI in pathology, and how you can use some of these things to improve efficiency. And I'll talk about it, the use cases as we go along. Medical research, of course, makes very strong case for use of AI. I think that's something, again, data-driven, consumer-driven, patient-driven. Again, the more data you collect, the more possibility of using AI over there and making predictions. Patient care, which if you ask me from perspective of all of us as consumers and, of course, AI practitioners, this is the most important thing. End of the day, you are the one, as a patient, whose health has to be taken care of, right? And it doesn't matter which part of the healthcare requirement you are at, whether you are at ICU set up in the hospital, ICU set up at home, you have a chronic disease to take care of, you have a physical ailment like probably the pain in the back or pain in the knee or whatever else has to be taken care of, rehabilitation, primary care, any of those things which are there. End of the day, all the roads lead to you as a patient, as a consumer. And the only way you can use AI at a generic level and, of course, at a personal level for individuals also is just by collecting more data, correct? So you have to be with the patient at the time what problem they are facing, basically connecting with them, using connected devices, collecting data regularly, and then seeing what you can do basis that data to create plans for them, right? And taking it back to ancient days in Ayurveda, you have patients' profiles, right? Kapha, Pitta, these are different profiles. And what probably AI will do, they'll also create generic profiles like that for different consumers, different patients as we will go along. And that's what we'll see from a patient care perspective. Disease diagnosis is a big area. We'll talk about it as we go along. And of course, personalized treatment plan. As we get the data together for a particular patient, for a particular consumer, how you can create the personalized care plans for them. And I think that's where the holy grail of using AI in healthcare lies. That's where all the efforts which you are seeing will probably lead into that direction. So what is happening in India? Actually, in India market, of course, is very different from the way you will see rest of the world. So what is the biggest healthcare challenge in India? Any guesses? Of course, no records. Accessibility, yes, very good. Yes, volume of data. So I'll tell you what are the two big issues in India. India's the biggest issue is we don't have enough qualified clinicians for the population we have, right? For every 1 lakh citizens, India has 64 doctors, okay? The worldwide, the developed countries average is 150. Now, what do? Can you move from 64 to 150 by adding more doctors? Of course, it will take its own time, right? I don't know if any doctors are over here. It's probably the longest graduation which happens in this country, right? Many of us become graduate in 3 years, 4 years, and then we get onto the job. Medical graduation happens over a period of time before you really start practicing. So you cannot create so many doctors, right? So what do? Of course, you use technology. Of course, telemedicine has been the talk of the town for last 2 to 3 years. And then can you take it forward to the next level? So how do you basically help a clinician, help a doctor to treat a lot more patients than what he's doing today? So this ratio of 64 to 150 is how you bridge that. And then 150 will not be relevant in next 5 years because people are living longer. People are living longer, but they're also living longer more unhealthy. They're living longer with more chronic disease, correct? India is the diabetes capital of the world. India probably is the unannounced hypertension capital of the world, right? So number of patients just by sheer volume is very, very high in this country. So how do you take care of that? You take care of that by using technology. And then, of course, using technology, you collect data. And using data, you basically create personalized plans. So that's something which is very, very critical. And second, somebody said, which is, again, very, very important point, accessibility. India is not one country, right? India is probably many. And we have been working in, as I said, 40 different cities. And we also learn each of these cities behave like different countries. Just by sheer population, many of our big cities are bigger than many of the developed countries, right, from population perspective. But even if you look at from different states, and if you look at different cities, the kind of care available in a Bangalore versus Mysore versus like another location, what we call a tier 3 town or tier 4 town or rural area, right? 70% of India's population lives in tier 4 towns and rural areas. And the level of care over there is quite low compared to what you're getting. So what we see, Apollo Hospital, Manipal, right next to us, available to us to get taken care of, the access to the healthcare in those kind of cities and areas is very, very poor, right? So how do you make sure that you bridge this divide, actually? The inequality which is there in healthcare, how do you bridge that? That, again, will get bridged only by using technology, and some bit of that already started happening in last few years, last 2 to 3 years, especially post-COVID. I think COVID was a big wake-up call for us as a country to start investing in healthcare. India said that we'll invest. Government said they will double the healthcare spends as a GDP percentage, and of course, a lot more action has happened. But now what we are seeing happening and should happen more and more will accelerate is that how do you use technology to make sure that remote healthcare is taken care of. So I would say those are two very, very critical points from India's perspective. How do you basically increase the clinicians' efficiencies, and how do you make sure that accessibility is available for everybody, right? So these are some of the key points. Of course, it just started picking up from a market perspective. India healthcare market is fairly large, close to 400 billion as we speak. AI expenditure is very, very nascent stage, will grow by all the projections. Will probably add to a $1 trillion economy to India by 2035. And of course, it's already getting integrated into diagnostics algorithm for screening the diseases, which is basically cancer, diabetes, which are, of course, the two big ones where a lot of work is happening. And of course, a lot of radiology, where a lot of good work is happening in India.